Good morning, everyone. This is Michael Jackson with the Florida Pharmacy Association, and thank you for participating in this webinar on understanding the Families First Coronavirus Response Act and also the CARES Act. We know that you are struggling with trying times and that as pharmacists, you are all engaged in the care and management of patients, and we understand the challenges that you're facing. But rest assured, we hear a lot of public support for what pharmacists are doing because you are on the front lines and you're the ones that are being labeled as first responders. So our sincere support from the Florida Pharmacy Association for your hard work, and we're behind you all the way. This webinar is being offered free of charge as a member service of the Florida Pharmacy Association. It is not for continuing education, but is mainly primarily to assist you with information on the things that are happening in Washington, D.C. related to this pandemic. Our webinar format will allow you to be able to see us and hear us. However, we will not be able to see or hear you. If for some reason you are hearing us, but it's distorted, please note that it is usually a good idea not to have multiple devices in the same room that are tied into the webinar, because that will create audio feedback that will make it difficult to hear the presentation. If you're able to hear this announcement, we did a test before we started, and we think our signal is getting out fine. If you're able to hear the announcement, somewhere in your webinar screen, you should see a chat. You can send us a note in the chat to let us know that you hear us fine. It is advisable to, I've already mentioned that. We'll have a few poll questions at the end of the presentation today to help you understand the content that's being provided to you. And also I wanted to let you all know that we will be recording this event so that those who are unable to hear or see the webinar, it will be available for you to view on our website, and hopefully we'll get that up on our website within 24 hours. It'll probably be posted on the calendar page for today, and you'll be able to see it there. Now, it is my pleasure to present to you our subject matter expert in this area is TJ Morton, who's the General Counsel of the Florida Pharmacy Association, and he's an attorney with the Lockwood Law Firm here in Tallahassee, Florida. The firm represents several clients with interest in Florida's medical marijuana industry, as well as serving as well as other areas. TJ has significant experience representing individuals and businesses in highly regulated industries, specializing in gaming, medical marijuana, alcoholic beverage, and healthcare. Prior to joining the Lockwood Law Firm, TJ represented several regulatory agencies, including the Florida Department of Business and Professional Regulation and the Florida Department of Health. This experience in the public sector allowed him to form a unique understanding of the inner workings and decision-making processes of regulatory agencies. He is a graduate from Florida State University College of Law, where he earned his Bachelor of Science in Cell and Molecular Biology from Missouri State University. So, ladies and gentlemen, please help me welcome Mr. TJ Morton.
Thank you, Michael, and good morning, everyone. Thank you for taking the time to sit in on this webinar. I know everyone is probably extremely busy, and you know, these are difficult times for everyone, so I want to appreciate everyone for all the work you're doing. Hopefully everyone is out there staying healthy and safe. So I'll jump right in here. This presentation is regarding the Families First Coronavirus Response Act, which I'll refer to as the FFCRA and the CARES Act. Both of these acts are huge legislative initiatives that contain several provisions that address all sorts of different things. For purposes of this presentation, I'm going to go ahead and focus on the paid leave provisions of the FFCRA and the Paycheck Protection Program provisions of the CARES Act. If anyone has any specific questions about any other provisions of either of the acts, feel free to shoot me an email and I can look into those and get a response to you. At the end of the presentation, I'll give everyone my contact information. So before jumping into the kind of nuts and bolts of the acts, let's do a quick overview of the coronavirus outbreak and how we got to where we're at today. So in late 2019, there were some cases of mysterious, let me jump right here. December 31st, 2019, there were some mysterious cases of pneumonia in Wuhan, China. Those cases are believed to have began in a live animal market there. That's not confirmed, although there's a pretty good understanding that's where they initiated. Speculation that the virus began in a bat and then transmitted to humans through an intermediary, possibly a pangolin. So 7 days after the first reports of the mysterious cases of pneumonia, China confirmed that they had identified a new coronavirus. They had ruled out SARS and MERS as the causes of the potential causes of the virus. January 11th, we had the first known death caused by coronavirus. This was in China. And 10 days later, we had our first case in the United States. This appeared in Washington State. It was traced to an individual who was in China. January 30th, our first reported case of person-to-person transmission in the United States. This was an individual in Illinois, and he had also been in Wuhan, China. So February 26th, CDC reports the first case of community spread in the United States. This was in California. The patient had not been, they had no history of relevant travel and had not come in contact with anyone who tested positive for the virus. February 29th, we had our first death. This was in Washington State. It was a man in his 50s with underlying health conditions. March 1st, a little closer to home, Governor Ron DeSantis declared a public health emergency in Florida. And on March 9th, he declared a state of emergency for the entire state. On March 11th, the WHO declared a coronavirus outbreak to be a pandemic. This is the first declared pandemic in history related to a coronavirus. March 13th, President Trump declared a national emergency. And on March 17th, the coronavirus was present in all 50 states. So we go from December 31st, 2019, we have some mysterious cases of pneumonia in China. 2.5 months later, we have the virus in all 50 states of the United States. It's pretty incredible how quickly it spread. I'll point your attention here to March 11th. That is when the WHO declared the coronavirus to be a pandemic. That is also the date that the FFCRA was introduced in Congress. So where are we today? This was actually at 8:15 last night. We had 2 million confirmed cases of COVID-19 worldwide, with about 135,000 deaths. If you look at the US numbers here, we were at 637,000. That seems kind of out of line with the other countries, but if you add up the populations of Spain, Italy, Germany, France, and the United Kingdom, the next 5 countries, those total to about 324 million. The population in the United States is about 330 million. So those 5 countries combined are about equivalent to the United States. If you add up their total cases, they're at about 715,000. So they're about 80,000 higher than us, even though we have about an equivalent population. So in that regard, I guess we're doing a little better than they are. If you look at the percentage of individuals who have confirmed cases based off the population, we're at about 0.2% of our population. Those 5 countries are at about 0.22%, so just a little higher than us, but we're roughly in line with them. The obvious outlier here would be China, reporting 83,000 cases for a population of 1.4 billion. If they had a 0.2% confirmation rate like we do and like those countries in Western Europe, they would be at approximately 2.8 million cases. So that would more than double the worldwide number of confirmed cases. So not sure if they're underreporting or if they just, based off the nature of their government, have much more aggressive quarantine measures, but it's kind of interesting how much lower they are than the rest of the countries here. Now moving on to the United States. So when I took this last night, it was at 601,000. The prior slide shows us at 635,000. If you look at the map here, you can see some of the hotspots are kind of the population centers, which is to be expected based off how the virus transmits. One thing is looking at this curve here, maybe I'm being a little optimistic, but it seems to maybe be taking a little bit of a right turn there and kind of leveling off. At least that's what I'm hoping, but we'll continue to track it and kind of see where it goes. Here's Florida. This was as of last night as well, 22,000 cases. And if you look at the confirmed cases day by day, it looks like it's to be leveling off and maybe even declining. So that's a good trend. So we're at about 22,000 cases statewide. We have a population of about 22 million. So that puts us at about 0.1% of the population. So we're at about half of what we were seeing for the rest of the United States and for those 5 countries in Europe. So seem to be doing a pretty good job. Hopefully we can maintain that. All right, so that's where we're at now. Let's move into kind of the FFCRA. So as I mentioned earlier, it was first introduced on March 11th. That's the same day that the WHO declared a pandemic related to the coronavirus. 3 days later, it was approved by the House. That was by a vote of 363 to 40. The 40 no votes were all Republicans. That's to be expected considering that the House is controlled by the Democrats. Let's see, 4 days later, it was approved by the Senate by a vote of 90 to 8. The 8 votes there were also Republicans, and it was also signed into law by President Trump on March 18th. So 7 days from when it was introduced, it became a law. That's pretty incredible how quickly it passed. I think it reflects the urgency that was recognized by Congress based off the situation. All right, so here are some of the key provisions of the FFCRA. It creates an Emergency Family and Medical Leave Expansion Act. It creates an Emergency Paid Sick Leave Act. It provides tax credits so that employers can pay for the leave under the expanded FMLA and the Emergency Paid Sick Leave. And it provides funding for free COVID-19 testing. All right, so the Emergency Family and Medical Leave Expansion Act. It allows eligible employees to take up to 10 weeks of paid leave if the employee is unable to work or telework due to a need to care for their child because the child's school or place of care has been closed due to a public health emergency related to COVID-19. So that's the only basis that an individual can use to claim leave under this act. It's only if they are unable to work or telework because their child can't go to school or their place of care, or if they have a babysitter and the babysitter is unable to come over as well. But if the individual is staying home to care for an ill family member, that's not a basis for leave under this act. It's actually very narrow. And it was intended, when all the school closures were happening after the outbreak, it was intended to allow parents to be able to stay home to care for their kids when they weren't able to go to school. So if the employee, as I mentioned, if the employee is unable to, oh, I'm sorry, this is a different basis. If the employee is unable to work because the employer does not have work for the employee, then the employee is not entitled to the paid leave. So if an employer is downsizing because they're just not that busy right now and they tell the employee to stay home, the employee does not get paid leave under this act. Let's see. This FMLA leave is different from traditional FMLA leave. Traditional FMLA leave is not paid. It provides for up to 12 weeks of leave so that the employee can stay home and do whatever it is they need to do, but it's unpaid leave. This provides for 10 weeks of paid leave. This is effective from April 1st, 2020 to December 31st, 2020. After December 31st, 2020, unless it's extended by Congress, this sunsets and the paid FMLA leave goes away. All right, so this provides up to 12 weeks of leave. Only 10 of them are paid. The first 10 days of the leave are unpaid. Now, an employee can use other accrued paid leave to cover those 10 days. So if an employer provides, paid sick leave or vacation, the employee could use those that leave to cover those first 10 days. But the remaining 10 days, the remaining 10 weeks are covered under this act. How much do they get? They get 2/3 of their regular rate of pay for the number of hours that the employee would otherwise have been normally scheduled to work. So they don't get a full 100% of their wages, they get 2/3 of their wages. And it's based off kind of what their hours would have been. If it's a full-time employee, they'd get 2/3 of their rate of pay for 40 hours. If they're part-time, you do your best to calculate what their schedule would have been had they been at work. The Department of Labor has said to use the employee's average daily hours over the 6-month period prior to the leave. If the employee hasn't worked for 6 months, then you should use the amount of hours that the employee and the employer had agreed the employee would work. And if there wasn't an agreement, then you look at how long they've been employed and just kind of do an average based off their employment history with the employer. So they receive 2/3 of their regular rate of pay, but they are capped out at $200 a day or $10,000 in the aggregate over 12 weeks. So again, they're not paid for the first 10 days. So $200 a day times 5 days a week would be $1,000 for a week. And that would be times 10 weeks is 10,000. That's how they came up with that. You're paid for 10 weeks, just not the first 10 days, but the leave is for a 12-week period. So employees who take the leave are entitled to be restored to their prior position or an equivalent position when they return to work. This is a hallmark of the FMLA Act. Employees are entitled to be restored to their position. The employer has to hold it for them. Now there are going to be some exceptions here. For employees who have, for employers with fewer than 25 employees, they're exempt from the restoration requirement if the position held by the employee no longer exists due to economic conditions resulting from the public health emergency, and the employer makes reasonable efforts to restore the employee to an equivalent position. So if you're a small business with fewer than 25 employees and you just don't have the work for them anymore because after the 12 weeks, work is just kind of tailed off, you don't have to restore them to that position. But you should make a reasonable effort to restore the employee to an equivalent position should one become available. Who's required to provide the expanded family and medical leave? Private employers with fewer than 500 employees are required to provide it. Now this is different from traditional FMLA. That was only required, or it is only required for employers with 50 or more employees. So this expanded FMLA is for all private employers with fewer than 500. It's a little counterintuitive that they're making the smaller businesses offer it, whereas the larger businesses are not required to do so. States, counties, and municipalities are generally required to provide the leave. There are a few exceptions here and there. However, most federal agencies are not required to provide the leave. There are some that are required to provide it. I do not know which one, so if anyone has any, if anyone would like to know which agencies are required, I can certainly look that up and get back to you. Now, employers are required to post notice of the emergency leave requirements in a conspicuous place in their, at the place of employment. Businesses with fewer than 50 employees are exempt from providing the leave when the imposition of the requirements of the leave would jeopardize the viability of the business. So generally, all private employers with fewer than 500 employees are required to provide the leave. However, businesses with fewer than 50 are exempt if the imposition of the leave would jeopardize the viability of the business. Now, what's that mean? The Department of Labor has come out with guidance explaining when the imposition of the requirements would jeopardize the viability of the business. So if the provision of the leave would result in a small business's expenses and financial obligations exceeding available business revenues and cause the small business to cease operating in a minimal capacity. So basically, if you're paying for the leave and it's causing the business to be unable to operate, that's a basis for being exempted. The absence of the employee or employees resulting expanded family medical leave would entail a substantial risk to the financial health or operational capabilities of the business because of the specialized skills, knowledge of the business or responsibilities. So if you have some sort of key employees who you need to be at the business in order for the business to function, that would be a basis to be exempted from the FMLA, the expanded FMLA requirements. And if there's just not sufficient workers available because they're out on the FMLA leave, that's a basis to be exempted from the requirements. And again, this would only apply to small businesses with 50 or fewer, fewer than 50 employees. Who is eligible to receive the expanded family and medical leave? Any employee who's been employed for at least 30 calendar days. Again, this is different from traditional FMLA leave. For traditional FMLA leave, only employees who have worked for an employer for 12 months are eligible for it. This is for any employee who's been employed for at least 30 calendar days, and it doesn't have to be 30 consecutive calendar days. Okay, so this is a big one. Employers of healthcare providers and emergency responders may exclude those employees from entitlement to the leave benefits. So any employer of a healthcare provider does not have to provide this expanded family and medical leave to their employees. Who's a healthcare provider? Anyone employed at a doctor's office, hospital, healthcare center, clinic, post-secondary educational institution offering healthcare instruction, medical school, local health department or agency, nursing facility, retirement facility, nursing home, home healthcare provider, or any facility that performs laboratory or medical testing, pharmacy, or any similar institution, employer, or entity. So anyone who employs, anyone who's employed at one of those facilities does not, or the employer can exclude those individuals from being entitled to the leave. And now this says anyone employed at any of these facilities, including a pharmacy. The way I read that, that would apply not only to pharmacists and pharmacy technicians, but it would also apply to a cashier of a pharmacy. So they don't have to be involved in the actual healthcare services from my reading of this. They just need to be employed at one of those facilities. What does this mean for pharmacies, pharmacists, and pharmacy technicians? It means that pharmacies and hospitals can exclude pharmacists, pharmacy technicians, and any other person employed by the pharmacy or hospital from being eligible to receive the expanded family and medical leave benefits. This applies to both public and private entities. So even though those individuals can be excluded, the Department of Labor has issued guidance cautioning the employers to be judicious in excluding those individuals so as to minimize the spread of the coronavirus. That's not so much applicable for the Expanded Family and Medical Leave Act, but it's more directed to the Emergency Paid Sick Leave Act, which I'll get into in a few minutes here. But moral of the story is that healthcare providers can be excluded from receiving those benefits at the discretion of the employer. Okay, so now for the Emergency Paid Sick Leave Act. This allows an eligible employee to take up to 2 weeks of paid sick leave if the employee is unable to work or telework because, and I should stop here and talk about this unable to work or telework. If you have to be, going back to the expanded FMLA Act, if you have to stay home to care for your child and you can't come to work, but you're able to telework, then you're not entitled to the benefits. It's only if you're unable to work or telework that you are entitled to the leave. So here, an employee who is unable to work or telework gets 2 weeks of paid sick leave if they're unable to do so because 6 reasons here. The first one is the individual is subject to a quarantine related to COVID-19. Reason 2, the individual has been advised by a healthcare provider to self-quarantine due to COVID-19. Reason 3, the individual is experiencing symptoms of COVID-19 and seeking a diagnosis. Reason 4, the individual is caring for an individual who has been quarantined or is self-quarantining. Reason 5 is caring for his or her son or daughter if the school or place of care of the child is closed due to COVID-19. If you recall, that's the same basis for getting the expanded family and medical leave. And reason 6 is experiencing any other substantially similar conditions specified by the Secretary of HHS. And I am not aware of any thing that the Secretary of HHS has issued yet that would cover reason 6. So these are the 6 reasons an employee is eligible to take up to 2 weeks of paid sick leave. Reason 5 here, the way it kind of relates to the expanded FMLA leave. If you recall, the first 10 days of expanded FMLA leave are unpaid. The employee can use their 2 weeks of paid sick leave under reason 5 to cover those first 2 weeks of expanded FMLA if they choose to. Reason 1, there was some discussion initially after this came out whether if a business has been required to close due to a local directive from the city or county saying, gyms, you have to close down right now. There was some question whether reason 1, whether that would be covered under reason 1. The Department of Labor has issued guidance saying no. Reason 1 basically means that if an individual is being told by a county health department to quarantine because they're positive for COVID-19, then they would get the sick leave under reason 1. If an employer is closed because a city or county has told them to close to stop the spread of COVID-19, that's not a basis for the employees of that employer receiving paid sick leave. So if an employer is closed because there's no work or they've been closed due to a directive of a state or local or federal agency, they're not entitled to the emergency paid sick leave. They would, however, be entitled to unemployment benefits. And the effective dates of the Emergency Paid Sick Leave Act are April 1st, 2020 to December 31st, 2020, same as the expanded FMLA leave. Okay, so what are the benefits of emergency paid sick leave? Full-time employees are entitled to 80 hours. And again, that's basically 2 weeks. Part-time employees are entitled to the number of hours that they usually work over a 2-week period. If the employee is taking leave for reasons 1, 2, or 3 on the prior slide, then the employee is entitled to 100% of his or her normal rate of pay. And that pay is capped at $511 per day or $5,110 in the aggregate. So going back to the prior slide, reasons 1, 2, and 3, so the individual is subject to a quarantine. Basically, they've been confirmed as having COVID-19. Reason 2, the individual has been advised by a healthcare provider to self-quarantine. So it's possible that they have COVID-19 and they're experiencing symptoms. And reason 3 is kind of similar to 2. You're experiencing symptoms and you're waiting to seek a diagnosis. So you receive a full 100% of your rate of pay up to the maximum amount if you yourself are experiencing COVID-19 or something similar to it. Now, if the employee is taking leave for reasons 4, 5, or 6, the employee is entitled to 2/3 of his or her normal rate of pay. This pay is capped at $200 per day or $2,000 in the aggregate. So this is in line with the pay that an employee receives for the expanded FMLA leave, 2/3 of their normal rate of pay capped at $200. So going back to reasons 4, 5, and 6, reason 4, the individual is caring for an individual who's been quarantined. Reason 5, the individual is staying home to care for their child because they're unable to go to school. Reason 6 is experiencing any other substantially similar condition specified by the Secretary of HHS. So these ones, you get 2/3 when you yourself are not actually experiencing symptoms of COVID-19, but you're caring for someone who is being impacted by it. And in those situations, you get 2/3 of your rate of pay, up to $200 a day. Now, who is required to provide paid sick leave? Again, it's private employers with fewer than 500 employees, the same as the expanded FMLA leave. Generally, public employers are required to provide paid sick leave. Now, this is a little different from the expanded FMLA leave in that most federal government agencies are required to provide this. States, counties, and municipalities are also required to provide it. Once again, businesses with fewer than 50 employees are not required to provide the paid sick leave for reason number 5, which again is when the individual is staying home to care for their child who's out of school. when the imposition of the requirements would jeopardize the viability of the business. And it's those same three reasons we spoke about earlier when making a determination of whether the business would be jeopardized by the leave. And again, it only applies to reason 5. So businesses with fewer than 50 employees are required to provide paid sick leave for the other 5 reasons. And again, employers should post notice of the emergency paid sick leave requirements in a conspicuous place in the workspace. Who's eligible for the paid sick leave? Any employee of an employer who is required to provide the leave. So unlike the expanded FMLA, which required employees to work for 30 days, any employee is entitled to this leave. However, once again, employers of healthcare providers and emergency responders may exclude those employees from entitlement to the paid sick leave. And it's the same definition for healthcare providers, and the DOL's guidance, the Department of Labor's guidance about judicious use applies to this as well. So they're cautioning employers to be judicious in excluding healthcare providers from receiving paid sick leave. I would assume particularly for reasons 1, 2, and 3, where the individual healthcare provider is experiencing symptoms of COVID-19. So once again, this means that pharmacies and hospitals can exclude pharmacists, pharmacy technicians, and any other person employed by the pharmacy or hospital from being eligible to receive the paid sick leave benefits. So who's paying for all of this? Who's paying for the expanded family and medical leave and the paid sick leave? The employers are paying for it. However, the Families First Coronavirus Response Act grants tax credits for expanded FMLA leave and sick leave paid to employees. So employers are required to provide this and to pay employees for the benefits. However, they're not getting a grant on the front end. They're not getting any sort of cash from the government. It's on the back end when they file their payroll taxes that they will receive credits for amounts paid to the employees. Now, these credits are 100% tax credits. So in theory, they should recover every dollar that is paid to the employees. Again, though, it's going to be a reimbursement and not sort of a grant on the front end. And they also receive a 100% tax credit for amounts paid for an employee's health plan coverage while the employee is out on the leave. And the tax credit is fully refundable. So to the extent the credit exceeds the employer's payroll tax liability for the quarter, the excess credit will be refunded to the employer. And again, these are paid quarterly. So there is going to be a lag in receiving a reimbursement for it. So the Families First Coronavirus Response Act also includes some provisions for funding for free COVID-19 testing. Basically, it requires private insurance plans to cover all costs related to COVID-19 testing and not imposing any sort of cost-sharing obligations on the insured or any prior authorization requirements. So it should be free for individuals. There is no deductible, no copay, or anything like that that should kick in. It also requires Medicare, Medicaid, and TRICARE to cover COVID-19 testing without imposing any cost-sharing obligations. And this includes not only the cost for the test itself, but the cost for healthcare provider office visits, urgent care center visits, and ER visits to the extent those visits relate to the need for the testing. I would assume that once they come back with a confirmed test, they're not going to continue to pay for the care for the individual, but they won't make it free, I should say. They'll cover what they cover, but the copay would kick in at that point. And these provisions last for the duration of the public health emergency, which is ongoing currently, of course. Okay, moving on to the CARES Act, which stands for Coronavirus Aid, Relief, and Economic Security Act. This was introduced in the Senate on March 19th, 2020. It was approved by the Senate 6 days later. It was unanimous, 96-0. approved by the House March 27th, 2020. There wasn't actually a vote in the House because the way this worked was the Senate piggybacked this legislation onto a bill that had already passed the House and was sitting in the Senate. So the House didn't actually vote on it because they had already approved the bill. But there was a process of reconciliation between the Senate and the House, but there was actually never a floor vote on it. But it was approved by the House on the 27th and signed into law by President Trump on the 27th as well. So again, 8 days from introduction, basically to approval, which is lightning quick. And this is a huge bill. They allocated $2.2 trillion to cover the different programs that are included in it. The one we're going to focus on here is the Paycheck Protection Program. It's a small business loan program that I'm sure you've heard quite a bit about. Congress allocated $350 billion basically for this program. And we'll talk a little bit about where that's at right now and kind of where that's going to go in the future. Additionally, the CARES Act included sort of enhanced unemployment benefits for individuals. It's providing sort of a federal unemployment benefit of $600 per week over the state maximum benefit for the next 4 months. So, for example, Florida's maximum weekly benefit for unemployment is $275, which is incredibly low. But the federal, the unemployment benefits in the CARES Act here allow for an additional $600 per week in unemployment benefits. So an individual in Florida could potentially get up to $875 a week in unemployment, which is a significant increase from what they would have got had this act not passed. Additionally, it includes stimulus check provisions, which I'm sure you've heard about. Individuals making less than $75,000 receive $1,200, and couples making less than $150,000 receive $2,400. The amounts gradually reduce up to, as individuals make $99,000 or couples make $198,000. It's phased out above that. And then $500 per child for each couple. So I understand those checks have been rolling out beginning yesterday. And this also includes some student loan provisions. All student loan payments are suspended through September 30th, 2020. This includes both interest and principal, and the accrual of interest during that time is also suspended. So it's a huge bill that covers lots of different things, but we'll touch in detail on just the Paycheck Protection Program provisions. But if anyone has any questions about any other provisions, again, feel free to email me and I'm happy to look that up and get some information for you. Okay, the Paycheck Protection Program, what is it? It allows eligible small businesses to receive up to $10 million in a forgivable loan from the SBA, the Small Business Administration, that can be used to cover payroll expenses, rent, interest on mortgage payment, and utilities. Now, this can be used for payroll, which includes paid sick leave and things like that, but it cannot be used to cover the expanded FMLA leave or the emergency paid sick leave that were created by the Families First Coronavirus Response Act. Can't use the loan for that because the money should be reimbursed through tax credits. And this program is intended to ensure that small businesses maintain their payroll during the outbreak. And so that's the bulk of the money should be used to cover payroll costs to continue paying employees, keeping them on payroll. Although the money can also be used to cover rent, interest on mortgage payments, and utilities. So as of Wednesday, 1.3 million PPP loans have been approved, totaling $296 billion. Again, they allocated $349 billion for the program. It's my understanding that they expect that money to be exhausted sometime today. And at the end of the presentation, I've got a slide that kind of talks about where we think it may be going in the future. The nuts and bolts of the Paycheck Protection Program. So small businesses with fewer than 500 employees are eligible for the loans. The loan can be fully forgivable, assuming the money is used for the appropriate purposes. And the loan will be forgiven if the small business maintains employee and compensation levels and uses the loan to pay for appropriate expenses. So as long as you maintain, or as long as an employer maintains their employees on staff and continues to pay them at the same compensation levels, and uses the loan to pay for appropriate expenses, which are payroll, rent, interest on a mortgage payment, and utilities, then the full amount of the loan will be forgiven. So this is, in essence, it's kind of free money for the businesses, which is why the program is so popular. I mean, if you were going to continue to pay staff anyways, why not get this loan and use the money? It's fully forgivable. So it would basically provide the employer with 2 months of free money. In the event that some of the amount is not forgiven, that will be carried forward for a loan life of up to 2 years. Payments on principal and interest will be deferred for at least 6 months. Again, this is for any amounts that are not forgiven. And the interest rate after that is going to be 1%. So even if the money isn't forgiven, it's a very low interest rate, and you have a 6-month deferral. And there's no fees associated with the loan. The lender can't require any collateral or require the borrower to personally guarantee the loan. So there's very little risk here for a borrower. And again, it's basically free money that'll be forgiven if it's used for the appropriate purposes. And once again, that's why the program has been so popular. Now, no more than 25% of the loan can be used for non-payroll expenses in order to qualify for the full forgiveness. So you can use 25%, up to 25% for rent, interest on mortgage payments, or utilities, but the other 75% needs to be used to cover payroll. All right, so how much of a loan can you get? So the amount of the loan is calculated by determining the small business's average monthly payroll cost and multiplying that number by 2.5. So average monthly payroll cost includes compensation to employees, payments for leave time, however, not the emergency paid sick leave or the expanded FMLA leave, payments for employee health insurance, and payments for retirement benefits. So basically what you do is you look at what your payroll amount has been for the 2019 calendar year. That's how the SBA is telling the companies to do it. You look at what your total payroll costs were for 2019. You divide that by 12. That'll give you your average monthly payroll cost. And then you multiply that number by 2.5. And that will give you your loan amount. Now, there is one exception here. Any costs exceeding $100,000 on an annualized basis for any single employee are excluded from the average monthly payroll cost. So if you have some employees who make, let's say, $150,000, you can only use $100,000 of their compensation for purposes of calculating your average monthly payroll cost. You would have to, you wouldn't get to include that additional $50,000. Here's a example for everyone. So in this example, there's no employees who make more than $100,000. The 2019 annual payroll from January 1 to December 31st was $750,000 for this business. If you divide that by 12, you get an average monthly payroll of $62,500. We multiply that by 2.5, and the amount of the PPP loan for this business is $156,250. So in theory, that's going to cover 2 months of payroll with an additional 25% for payments for utilities, rent, interest on mortgage payments, things like that. Here's a second example that includes a business with some employees that make more than $100,000. Their 2019 annual payroll was $1.5 million. If we subtract out the employees who the compensation amounts in excess of $100,000, the revised 2019 payroll is $1.35 million. We divide that by 12. Their average monthly payroll is $112,500. We multiply that by 2.5, and their loan amount would be $281,250. All right, now what's the current status of the Paycheck Protection Program? As of yesterday, I think these numbers are updated from what I mentioned earlier, 1.4 million PPP loans totaling $301 billion have been approved. It's expected that the full allotment will be exhausted today. However, Congress is working to approve an additional $250 billion in PPP funding. That has not gone through yet. I understand they are currently negotiating it. There's a hang-up. The Democrats want an additional $250 billion on top of the $250 billion for PPP. They want the additional $250 to be granted to cities, municipalities, states, and hospitals to assist with the coronavirus outbreak. But it seems that both the Democrats and Republicans are in agreement to approve an additional $250 billion in PPP funding. So I think that'll be coming at some point. It's just a matter of kind of getting through some of the other hangups. And so that is the conclusion. If anyone has any questions, I'm happy to answer them. I see a chat box. You can put them in there, or if anyone just wants to email me directly, I'm happy to answer any questions that anyone has.
Thank you so much, TJ, for this presentation, and for our guests that are listening in and watching the video. We do have a poll that's up. You should be able to see it on your screen. If you can begin responding to the poll, it's going to be held anonymous. So if you can just let us just look through the questions. There's a few of them here, only take a couple minutes to do that. Once we have the responses in, I'll go ahead and post it on the screen. Also, if you have any questions while this poll is running, there is an area in under the chat room. If you want to go ahead and pose your question in there, we do have a few minutes before we close things out for today. You go ahead and do that. We'll go ahead and take care of that for you.
And as an update, I just see an article here that says the Paycheck Protection Program has hit the $349 billion limit. So it's, as of now, out of money, apparently.
In the short time you've been doing this.
That's right.
Also, as a reminder to everyone, we are recording this session, and there's, I believe that TJ was kind enough to write an article to be published in the journal for our members. So watch for that in a future issue of Florida Pharmacy Today. Also, as a reminder, the slide deck that you've seen here in this webinar is available on the Florida Pharmacy Association website. If you go to the calendar date for today, you'll find it in there. And also this webinar it has been recorded, and we'll publish that on our website sometime in the near future. Okay, in just a second or two, I'm going to go ahead and end the poll, and then I'll share the results with everyone so you can see how the information was shared. And as you can see, if you could see the results, you'll find out that this is an extremely complicated issue and difficult to get your hands around. So, and it's going to take a lot of digesting to understand how it would work for you. All right, so I'm sharing the poll results, and you can see the response rates is pretty mixed in a lot of the discussions that we shared with you today. So hopefully the reviewing of the slides that are available on the website, and also once we get this published on our website, will help provide some clarity. Okay, seeing no questions in the chat room, I think that is the end of our webinar session for today. I want to thank all of y'all for participating in this webinar.
Michael, actually, it looks like we do have one question.
Oh, okay. Can you see it from your side?
Yes.
Okay.
So the question is, for the COVID-19 testing and visits being covered completely by private insurance, what if patients have no insurance? Well, so the CARES Act includes requirements for Medicaid to cover it, but there's nothing in there that I'm aware of that would handle this situation.
There's another question in there.
Okay, so the question is, if the parent company is over 500 but has a sub-company LLCs for the pharmacy, will the pharmacies be covered under these acts? So there are affiliation rules in the law that determine when you consider affiliated companies in calculating the 500 employee amount. The affiliation rules have been waived for restaurant and hospitality industries, I believe, but no other industries. So I think generally, and it depends on how related these companies are, but generally you would include all employees of the affiliated companies in calculating whether you've met the 500 employee threshold. So it's probably a very fact-specific analysis depending on the level of relation between the companies.
Okay, there is a question in the Q&A section here, and the question says, if hospitals or clinics are charging for tests, should they be reported?
Well, so my understanding of the COVID-19 testing funding provisions in the CARES Act are they require the insurance companies to pay it without requiring any sort of copay. So I don't think there's a problem with a healthcare provider charging for it. It just needs to be covered by the health insurance. Now, if they won't provide the test without receiving a copay, that could be problematic. But simply charging, I don't think is a problem. It's going to be a question of who's actually paying for that bill.
Okay, there is another question here. It's an excellent question. It's one that popped up yesterday in conversations I've been having with our stakeholders. It's a little bit off our subject, but the question is, will pharmacies be involved in expanded testing when the tests are available?
Yeah, so maybe I'll defer this to Michael a little bit, but you know, pharmacists come July 1 are able to test and treat in Florida for various ailments. There's whether or not COVID-19 will be one of those is going to be up to potentially the Florida Board of Pharmacy, but I guess the feds could allow for pharmacies and pharmacists to do it, but I think it probably will still be up to the individual states to determine if that will be allowable, because states do regulate the practice of pharmacy. But Michael, I'll let you kind of jump in on that.
Okay, and I've struggled with answering this question as well too. Many of our stakeholders have heard that the feds, the federal government, is allowing, or rather creating pathways for pharmacists to be able to test and treat patients with COVID, becoming more intimately involved in the care of patients and taking on the role of primary care providers. But the practice of pharmacy is regulated by the states. And so our state laws don't really have, at least currently now as of today, don't have a pathway for pharmacies to be able to do this. Current Florida laws allow pharmacists to order and evaluate laboratory tests in just two settings. I think one is home healthcare setting, the other is in a nursing home. And so one of the things that we've been advocating before our state's governor is to take a look at what's in current Florida law and to see if he can maybe consider some type of emergency order that would remove those strict restrictions that will allow pharmacists to do the kinds of things the federal government wants us to do. There is, I think, as TJ mentioned, a bill that passed during the 2020 legislative session that we're reporting to you in our annual report, and also will be in our legislative report that will be published in this month's journal. The results of that session that allows pharmacists to provide significant care for patients who are either have chronic illnesses or non-chronic illnesses, to be able to test and treat patients for many of these kinds of diseases. And I think COVID kind of follows in with that. But that law does not take effect until July 1st. And in this case, we don't think the governor can order a law that hasn't taken effect to write an emergency order against that. So I think the issue is still pending on that. I think our advocacy here is to convince the governor to at least remove some of the barriers to allow pharmacists to do the kind of testing that the federal government would like for us to do. Okay, any other questions by our audience here? Okay, with that, thank you all for being with us today from the Florida Pharmacy Association offices here in Tallahassee, and also from the offices of the Lockwood Law Firm. We wish for everybody to be safe, and we're working with you. We'll be here with you throughout this. We'll get to the end. Thank you so much for being with us today. Have a pleasant day. Have a pleasant weekend ahead.